Hi guys, I wanted to make a video today to talk more about the Bertolottis syndrome. Um, Basically, it's been several months now since my back surgery, so this is a video about how the surgery went and then post-surgery complications and pain and all of that. I've had a lot of questions asked over the internet and social media and phone calls, and I'm sorry that it's taken me so long to make a video, but I actually think right now is a great time for a video, just because there's been changes as far as pain levels and things. Um, I've been doing really well for a long time, and then just recently I've been experiencing some complications. Nothing too crazy or severe, but it's just different than I've been feeling. So I kind of think that now is probably a good point for me to make a video, just because after the surgery I thought that I was in the clear, and come to find out I've just experienced some other things. So to get started, this is might be a long video because I'm trying to do it all in one fell swoop. Although there's a lot of different things, and several months have passed, and so my memory isn't great to start, but I'm going to do the best I can to try to recall. And I actually looked back into some text messages that I had with my pain doctors, as well as my surgeon and friends, to kind of recall like how I was doing at different times with recovery. So just to kind of recap from the beginning, um, basically I had a sacralization of the L5-S1. So what that was is my transverse process on my L5 on the left-hand side was enlarged. So basically that transverse process, bone enlargement, was rubbing with my illium, so the top of my hip, and then the sacrum. So it was a bone-on-bone issue, and the rubbing created a pseudo joint. So with that articulation of the two bones, my body was using that area as a joint and created. Um, I'm kind of talking in a more of like a personal training term, but it's creating drive off of that pseudo joint. So it's actually using that articulation as something to, have force against. So that's kind of where a lot of my pain came from, especially with movement. Um, so there were certain movements that were extremely very, very painful. Um, and then there were other movements that were not as bad, but I did have a very dull pain throughout the entirety of having this issue. I've always had low back pain on that left lumbar side. And it's just because I have had this issue now and finally had gotten it diagnosed. So anyways, starting from the beginning a bit, you guys can check out my first video if I'm not touching as deep into it as I did in my first video. But originally, when I had realized what was going on, I had gone to a chiropractor for some emergency x-rays. One night I was doing a heavy deadlift and I thought I had blown a disc or something like that. So I immediately went in, and just I had a lot of pain, and it wasn't in your typical like disc herniation or disc bulge area. So I didn't know necessarily what was going on. But when she took the x-rays, she had said this is kind of an abnormal thing, and I was able to see the bone very well on that left-hand side and how enlarged it really was. I would say throughout this whole process, her x-rays were probably one of the best where you could see the bone the most clear. Because then, of course, I got a lot of follow-up imaging. I had several other x-rays through the surgery center. I had several MRIs, and a few other things just to make sure that the bones were actually articulating, that there was the sacralization, which was basically just the sacralization is where your bone starts to fuse with your sacrum. So it kind of locks up on itself. And so with all of that, we ended up realizing what was going on, and I did a lot of self-research. So originally when I was diagnosed, I actually self-diagnosed, and the healthcare system, excuse me, and a lot of the doctors locally in this area really gave me a hard time about what was going on with my back. Although it was very clear and apparent in the x-rays, it still seemed to be a problem to get anything done. So I kind of ran with it and took my self-diagnosis and was very, very certain of what was happening. So I did a lot of self-research. So basically your sacralization of the L5-S1 or enlarged transverse process or Bertolottis syndrome, those are all one and the same. So when I was first doing research, I was uncertain of which one I fell into, but it's just a few different names for one thing, taking place. So anywho, I kind of went with that self-diagnosis. I really, really had to push doctors for them to get imaging for any sort of pain relief, anything like that. So that was really tough. I ended up going down to Phoenix to because I'm in Prescott, Arizona, and so I ended up going down to Phoenix for all of my treatment and all of my pain management. And I went to Nova Spine Pain Institute with Dr. Baker, who I highly, highly recommend if you're anyone local. Dr. Baker took great care of me. And at the time when all this stuff was going on, I was actually competing a lot. So pain management for me was a huge deal because I was still trying to be an athlete and trying to be a coach while trying to figure out if surgery was the right way for me for this underdiagnosed issue that you really can't find research on. And I wasn't sure who was going to be my surgeon. So I had ended up reaching out to him because I was kind of out of luck as far as a right path to go down. So with that, before I had gone to him for any invasive types of pain management, I had gone through different forms of therapy. So I had done aqua therapy, physical therapy. I tried training heavy, I tried different styles of training. I tried more physical therapy styles of training. I tried no training at all, which for me being an athlete, taking a break from training kind of made a lot of the issues and pain worse, which I know that sounds silly, but just for my body, with me atrophying during that time of not doing a whole lot, it just was really painful. So I tried to keep a pain management regimen along with my training regimen so that they could kind of go hand in hand. And if someone has questions about that, I can dive deeper into that because it's really a balance of trying to manage pain or take drugs or not overtake drugs, or whether to compete or not to compete, or whether to train or how heavy to train, different movements. Like I kept a little bit of a journal on that kind of thing because a lot of people struggle with back issues, and that's what I do for work. So I just kind of kept a journal on that, what worked for me and what didn't. So if anybody has questions, I'd love to talk to you guys about that. But so anyways, I also tried chiropractic work and massage work. For me, the massage was great, although I think it was only good for a period of time. I would go in and get a massage, and it would kind of loosen up my muscles to where I think it would take the pressure off the bone on bone. So what that did was it made me feel really good, but also shortly after that, I would stand back up, it would kind of lock back up again, and I think my back would also kind of lock up just based on the trauma there. So chiropractic work was rough because I think different adjustments and things would have the bone articulation a little bit uh, more so in different adjustments versus others. Although, I do like chiropractic work. It just at the time I stopped doing chiropractic work because I knew it was a bone-on-bone issue instead of much else. Although through chiropractic work, I did realize that with the x-rays of the L5-S1 area, we also had x-rays of the SI joint regions. So basically, typically your SI joints, usually it's about a hair's distance apart where you can barely see between them. For me, the spacing in between my SI joints were really significant, where you could almost stick like a pencil or a rolled up dollar bill, like in that space. So I actually have a lot of SI joint pain in general because I think what had happened was over years of lifting, um, Olympic lifting, high intensity stuff, vertical jumping, that sort of thing, the bone that was rubbing with my sacrum and my ilium, I think over time had expanded my SI joints. So basically, I had a lot of separation there. So there was a period of time where I wore an SI brace. I think that there's another name for that, because a lot of times what happens in pregnancy is women will have SI joint pain just because carrying, they have a lot of spacing with expansion of their hips. So a lot of that spacing comes from the SI joint. So a lot of times people will have SI pain. So I think that there's some sort of pregnancy belt, SI belt that you can order. So there was a period of time where I wore an SI belt, and it's super embarrassing. I had to wear dresses all the time. Um, Actually, one time I was lifting and they said I couldn't wear a skirt in the gym, but I did. I had shorts underneath the skirt. But it's so embarrassing to have that belt on. But um, for me, it was one of those things where I was wanting to fix my SI joints, or at least take the pain away, because with having all that pressure on my SI joints, with every step, I would feel a lot of pain, and it would almost feel as if you had pulled your groin muscle, but it's very like internal on both sides for me equally. And it's in your groin region where you feel a lot of that discomfort. A lot of times it would be like a sharp mixed with a dull style pain. But I think that can change dependent on what you're doing, and how bad your spacing is and all that. So basically, wearing the belt took the pain away because it compressed those spaces. So it did, as far as my SI joints go, it took a lot of the stress off of them and a lot of the pain off of that groin area, which was so uncomfortable. Um, so I tried wearing it while I was sleeping. I tried wearing it while I was training. I tried wearing it while I was walking. I think though over time wearing that, it might have created my hips to really become more concave. So now my massage therapist is working on opening back up my hips and also compressing my SI joints at the same time. So just be cautious of that when you do brace your body, some other things can happen that maybe you don't expect to happen, which for me, I was more concerned about taking the pain away from my SI joints than necessarily having, an anatomically correct hip placement. So anyways, moving along, for me, I really got sick of doing a lot of different therapies to try to fix the issue because I knew that it was like a simple bone on bone thing. It seemed pretty simple to me that, if you have bone articulating with bone, that's something that you need to get rid of, because I didn't have any more room in my body to move the bone around as far as adjustments. And, you know, I couldn't really take the pain away if there was this constant articulation. So for me, surgery from the beginning was pretty apparent. but that was just because of the severity of my bone growth. So a lot of times people will have this issue and they'll have slight pain, but their bone enlargement is not to the point where it's constant like that. Um, so I think it's just dependent on what you are, in need of based on your lifestyle. A lot of times people can put up with it because, they work a desk job or their lifestyle doesn't necessarily rely on them, in having that large amount of pressure down on their spine. And for me, that was kind of a big deal, where my body has to work for me in order for me to compete and to train and to kind of do my job. So, anywho, I ended up then moving along to Nova Spine Pain Institute, where they did an epidural injection several times over. So I think the first epidural injection, yeah, I think I got two. So my first epidural injection, it was fantastic. I should say that we did a preliminary injection, where I went down for a day. They did an injection of lidocaine, which was extremely temporary. It was only about an hour of pain relief. But the reason that they did that was they injected my SI joints and they also injected my um, Bertolottis syndrome spot. So that L5-S1, they injected that area. And basically all that was to do was to determine which was causing more pain. Was my SI joint the main source of pain for me, or was it the Bertolottis syndrome? For me, it was pretty obvious, but of course, like before you go into surgery, you want to make sure that obviously you're operating correctly and making sure that the surgery will take that pain away. So we ended up doing that immediately after I got the lidocaine injection. I felt phenomenal. I had no pain in my SI joints. I had no pain in my spine or in that articulation area. So my plan for that day, get the injection and then immediately go do all of the movements that were extremely painful for me, just to see how my body reacted with no pain, going throughout those movements. And what I found was it was fantastic. I was able to deadlift. I was able to do a strict toes to bar. I built up some pretty heavy weight, which was great because I wasn't able to do that for several months prior, just because of the amount of pain. I was able to go through a lot of different style of Olympic lifting, with that heavy impact or that heavy jump, and just moving your body around in a very fluid motion. So anyways, I really didn't have any pain, although I still noticed that with the deadlift movement and with the toes to bar movement, those were some big ones that were causing issues. I still was able to feel the articulation, but not necessarily painful. It was more of like a locking sensation. So I obviously, still knew that that was there, but just not a lot of pain came with that. So the only issue with working it that way was immediately after that lidocaine went away, which was only about an hour. Obviously I figured that I would be in a significant amount of pain. So with that having been planned, I had gotten set up with some pain medication stuff. So I did a couple of lidocaine patches, which is just a subcutaneous. Well, no, that's not correct. That one was a topical patch that you put right over top of the area that you wanted relief on. So those were fine. I also paired that with I think a couple other prescription medications. I don't necessarily remember exactly what I got prescribed at that time, but I know that I've played a lot with tramadol, oxy, hydrocodone, muscle relaxers, things of that nature. So I forget at that time exactly what I did for that day. But then following up after that appointment, I had gone down for another injection, although this time it was an epidural injection, which basically the epidural is kind of a broad statement because he used kind of a mix of different uh, steroids and different things within that epidural. So he basically took the needle and went and put it into the Bertolottis syndrome section of my spine. And then with that, um, the only thing with that is that you have potential of poking your spinal cord. So I believe it's called an NSF leak. Yep, that sounds about right. There is potential of an NSF leak just because of the needle coming so close to your spinal cord. So if you're having complications after an epidural, that's just something to think about. I did have complications, although I don't believe I didn't really necessarily follow up immediately to go address the issue. I wanted to wait a couple days to make sure that it wasn't going to fix itself on its own. But if you do have complications and it concerns you, I would call that doctor or someone that you know that is familiar and just follow up to make sure that you're not having a major NSF leak. I believe that they would go back in and do a second injection and do uh, maybe like a PRP or something like that to kind of fill that hole and close the leaking. So I think I've looked into it very briefly, but if you are having complications, I would look into it a lot closer than that, obviously. So anyways, this is turning into quite a long video, but there's a lot of stuff to go over. So after my epidural injection, I only had relief for about a week. Now, given with that week, I had absolutely no pain. I felt completely normal. I was able to train normally. I was able to compete. I was able to do a lot of the movements that I was unable to do before. So that week was fantastic. But shortly after that week came to an end, all the pain just came rushing back. So I was pretty crippled up after that week just because I had pushed my body so much. And, it was really traumatizing for that section of bone on bone. So I think that after that week, I mean, I could barely move, although I did have kind of a pain management regimen. So I used that, but I also was pretty SOL. So after that, we kind of looked into some other options just because I knew that I couldn't continue to get injections, especially with me. I didn't want to have that steroid continuing to break down anything in my body just because that there's a risk of that, if you exceed the number of injections that you're supposed to have over a period of time, or if you use up all those injections, you don't really have any other out. So I kind of knew that I wanted to go down the surgery route at that point, because I thought I was going to get a little bit more relief than that. Although for me, I ended up going in and getting a third injection because I had a competition coming up that I wanted to compete in. So I ended up getting that injection, I believe, just to hold me over for the competition. And then I kind of went through that same cycle of coming off of the injection. And it was still about the same period of time. We did talk about PRP, the platelet-rich plasma, and we also talked about stem cell injection, which I was technically a candidate for, although for me it just didn't make sense because of the bone on bone. I would rather have had the surgery, take it out, fix it, and then as long as it seemed reasonable from my surgeon and kind of everyone else involved, I was wanting to go that way instead of continuing to get injections and just dealing with the complications. I think that was the most frustrating part for me, was with experimenting with a lot of these different things, a ton of complications can come out of it, which is extremely frustrating. And so I was kind of at that point, just ready for surgery. So finding a surgeon was very difficult. My insurance was Blue Cross Blue Shield Federal, and finding a surgeon that was covered through my insurance was difficult, and also finding a surgeon that was um, wanting to do the operation was difficult, just because um, it's more uncommon than a lot of people think to go through and get surgery. So I ended up finding Dr. Tiffany Perry with Cedars-Sinai Medical Center in Beverly Hills, California. And that was from one of my dad's friends. Um, um, his name was Richard. Basically, he acted as a mediator for me, because I went through everything that was needed, to line me up for surgery, and I had all of my imaging, and it was just such a long, long, long process, to where, for me, it's actually, it was one of probably the most frustrating times in my life, to where I kind of got to the point where I was really suffering with pain. Um, I had goals, I had the competitions in mind, I had a lot of things that I was trying to do, include open up my gym. Um, and I got to the point where it was so hard to manage trying to find a surgeon, trying to open up the gym, trying to be an athlete, trying to be a coach, trying to, deal with all of the insurance crap, trying to push the fact that it was as painful as it was, trying to get all these things lined up. So for me, I had my dad, who was a huge player as far as setting me up for surgery, because he was able to take care of the small logistical things, which I am so thankful for. And he ended up getting me connected with with Richard, who was my mediator through Cedars-Sinai, which was great because Richard was extremely familiar with the facility. Of Cedars, and he was very well connected with all of the doctors and surgeons and things. So I am just so forever, forever grateful for Richard, because I just cannot even express how frustrating it was for me at that time. So, anyways, with Richard, he was able to make sure that I found the right surgeon, and then all of my appointments and things were set up. So it really actually makes me emotional, because it was just such a really hard time for me. And things are so different now. So, yeah, so I would say, if you're having a hard time with the process of it all, do everything you can do to make connections with people, or find those people that will go out of their way to help you. Sorry. Because it really is frustrating. It can be very frustrating. So, anywho, basically, Dr. Perry had me come out for an initial appointment, and I met with her, talked with her. She was so fantastic, extremely, extremely knowledgeable. I felt so comfortable. Um, I think that I couldn't have had a better surgeon, because truly, we talked about everything. I talked about my concerns with competing. I talked about my lifestyle. She completely understood where I was coming from, which was huge, because as an athlete, or if you live a certain lifestyle, not a lot of people will take that seriously. Um, but there was no way that I was going to be able to not have the surgery, and she completely understood that. So she was fantastic. She was very, very, very personable. Her bedside manner was phenomenal. Both her and her PA were just extraordinary. So I ended up staying very well connected with her, and we messaged back and forth quite a bit as I had concerns leading up to the surgery, which I'll talk a little bit more about later. But yeah, so went in, we took a ton of different x-rays, a ton of different imaging there at Cedars, just to make sure that we were all on the same page. And then originally, right off the bat, she had said that there's some possibilities that we might have to do fusion of the spine and or put some hardware in, whether that's like screws or rods. And for me, that was a little bit devastating because I knew that that would take a lot of my mobility away with my training and just the things that I enjoy doing. So we continued with imaging, continued with different scans and things to see if my back would be able to support itself after surgery. We ended up being able to just go in and do a complete resection of that bone. And so basically now the transverse processes on the sides of my vertebra are equal. And I'll try to post some pictures of that before and after the surgery. I'll try to maybe include those in this video, but as far as the surgery goes, she went in and did the resection. I have two scars, one on that left side lumbar area, which was where she went in and did the resection itself. And then I also have a scar on the midline of my spine, and that's where she went in and had the scope going to where she was able to operate kind of more, I guess I'd say less invasive. So it wasn't a huge surgery because we tried to keep it as less invasive as possible. So I was very thankful for that. But the scar on my spine healed a lot worse than the scar on my lumbar on that left side. So I'll probably go back in and actually get a touch up on this scar on my spine just because it really did not heal that great. I think that was just because the curvature of my spine when I was able to move it, that affected the way that the skin kind of stayed together. So anyways, I really hope that you guys are getting a lot of good information out of this. I just know that for me, a lot of the small details I could not find, and I had to do a lot of self-research, and it was very, very time consuming. So I'm hoping this video helps a bit. So anyway, let's see. As far as the day of the surgery went, after my first initial visit, we had planned out the entire surgery. I had gone back, I'd flown back home to Prescott, and I had, done the best I could to manage pain all the way up until surgery. I had planned to have the gym open and kind of everything set up in line because I knew that I was going to be pretty out of it for after surgery. So come surgery day, the way that I had set up my recovery was I decided to do an Airbnb out in Beverly Hills just because I wasn't going to be able to fly on a plane for several hours after the surgery, or I should say several days, I believe they had said. So flying wasn't really an option. And then also sitting in a car to drive back was not really an option because I knew that the pain was going to be pretty significant and I wasn't wanting to sit in a car for 6 hours or however long that would be, especially because I was prescribed to do as much walking as I could. So I chose to just stay in an Airbnb for about a week um, after the surgery. So I had my surgery on October the 15th. I stayed in California for 1 full week and had my recovery out there, which is what I recommend. I think that would probably be the best, unless obviously you're having that surgery in your hometown or whatever. But I would limit travel as much as you could. Um, so on the day of the surgery, I was extremely nervous, extremely nervous, just because it was a very uncommon surgery. And I did not know the stability of my back after it. After the surgery, I did not know if I was going to be an athlete or, if I was going to be able to do the things that I wanted to do after the surgery. So it was a bit nerve-wracking. Anesthesia is always nerve-wracking for me. At least I just know that there can be complications with surgery, so that was really heavy on my mind. Um, so it was a very hard day for me. Um, I believe the surgery was 2 hours long. I don't know. I kind of wish I had a few people here with me that were there for my recovery because I don't necessarily recall. I believe it was a 2 hour long surgery. Um, very, very good, very successful, full resection of the bone. As far as post surgery, I was on the hydrocodone, tramadol, oxy, stool softeners, muscle relaxers, um, and then I think I did a lot of like icing and that sort of thing. Um, After the surgery, they wanted me to walk, I believe that day or the following day, immediately after, they wanted me to start walking, which was very difficult because the entirety of my body shifted because it used that bone on bone as a point of contact. So walking, sitting, moving, everything was extremely difficult just because it used it as a joint. So that was an issue for me. Um, I noticed a lot of different things as far as relief goes. So I think